So you have a patient comes in, they have this chronic pain. You've done your physical exam. You have an idea of what's going on in the individual. How do you put together what you're finding, what treatment's going to work for them? More importantly, and I love this part about you, how are you going to verify the benefit of the therapy on the back end of that to make sure they know what you did had that benefit that we expected it to?
Yep. Yeah. So, once we come up with our treatment for whatever it is, let's say it's a rotator cuff and we're going to use some PRP because it's on that mild to moderate end PRP, which is platelet-rich plasma, where you concentrate your platelets and inject them into the areas that are damaged to stimulate a new healing response. Is in the last, I would say 5 years or so, people have gotten very serious about the importance of what's being injected. In the past, it was kind of like, here's a kit, this will make you X amount of PRP, you're going to inject that, and that's your treatment. What we're learning now is that the PRP is treated kind of like a medication dose, because everyone has a different starting level of platelets. When you draw X amount of blood, you're going to get a certain amount of platelets in that final product. And that's where a lot of the research in the beginning was very mixed, where it was like, PRP doesn't work because this study said it doesn't work. Well, then you actually start digging into those studies that aren't working, especially those older ones. They either never told us what the final platelet count was, or if they did, it was very poor. It was barely above a normal range of platelets. And so, for example, let's say knee osteoarthritis, we have really good evidence on injecting anywhere from kind of 5 to 10 billion platelets inside of a knee joint. I know that has the most evidence behind it in terms of giving the longest term relief. In more severe cases, sometimes we'll even go a little bit higher than that. But how do you know how many platelets are in this final PRP? And that's where, I really respect Protea for caring this much about it, because you guys test blood all the time. You're verifying your inputs and your outputs on how patients are doing on their medication, how they're feeling physically. You're combining those two together. What we do is we have a machine in office, which is, I think, unique to us and, very few docs around the country, in my opinion, from what I understand, is, we'll test the platelets just in the blood, just to kind of see where that starting number is. And then I can know how much PRP I need for the whole case. And then I can calculate how concentrated I want that final product to be, how much PRP I need, and then how many platelets I need per each injection. So then I can very specifically calculate how much blood I need to draw, which is, from a safety perspective, also important. And then when I finally make that PRP, I can test it again and say, okay, I have the right concentration of PRP and platelets in here, so that when I inject inside the knee, I'm going to get that 10 billion that's going to give us the best result.